Gel injection to the knee, some additional information. You've seen about videos on the gel injection into the knee joint, so I just want to add some extra information where that substance is concerned. And just as a refresher, this here is a model of the knee, thigh bone, shin bone, that's the kneecap. You have cartilage between the kneecap and the thigh bone. This blue here is also cartilage. You also have cartilage on these surfaces right here as well. And remember, there is a lubricating fluid or synovial fluid that also helps the knee to become lubricated and so it can move easily. The gel, this is a 2 milliliter syringe where the gel is concerned. And of course, you'll want some more information on that. So here's some extra information. Okay, so as stated before, the gel, it is a temporary replacement for that synovial fluid or that lubricating fluid in the knee joint. The gel itself, it is actually useful in all stages of knee arthritis, mild, moderate, and severe. Of course, if you give the gel in the mild or the moderate state, you're going to get better results as opposed to the severe state, or what we would call loosely the bone-on-bone type of arthritis. Okay, so also now the gel itself is most effective in people who are actually using the knee joint. You might think that a person who's sitting down a lot more will actually benefit more, but not so. It is actually most effective and can give the best pain relief in people who are actually moving around, walking, moving up and down, and those who are generally want to keep active. Yeah? So if you get the gel, we do encourage activity after taking the gel as opposed to being sedentary. In terms of injecting of the gel it is meant only for intra-articular use, in other words, intra-joint use. When the gel is injected, it is meant to go within the joint space. The gel is not for use, for example, to be injected through a vein, to be taken orally. Also as well, let's say, for example, someone is trying to do a gel injection and they miss and they hit tissue that is outside of the joint space, and that is not going to be very effective. It is not meant to be injected around the joint. It is meant to be injected directly into the joint. Okay, so there's a bit of a difference there. So who are not candidates for this gel injection? Now, with any drug, with any food, there are a certain percent of people, who will have allergic reactions to those substances. So, of course, if a person is allergic to the components of the gel, these people are not candidates for the gel. So, let's say a person goes in and they get the first shot and they have an allergic reaction to the first shot. Obviously, you don't want to even attempt a second shot. An alternative will be need to found for such persons. Another group of people who would not be candidate for the gel injection are those, for example, if a person has varicose veins or lymphedema, which has led to swelling all the way up to the knee. Such persons will not be candidates for the gel injection. Person will need to have those conditions properly managed or resolved before we can even attempt doing an injection into the knee joint. And then there are those who have maybe an infection around the knee. If not superficial infection on the skin of the knee would exclude a person from getting that injection. The reason for that being is if the person has an infection on the skin and you inject and you break the skin, what can happen here is that you can actually transfer bacteria from the skin all the way into the joint capsules. Now, as a side note, if you look at our videos, we do clean with alcohol first on the skin, then we pass iodine as well, and then we use the sterile gloves. Okay, so we try to be as clean as possible when we are doing a joint injection, any joint injection, and not just the gel, but even with the steroid and the plasma. We would take those precautions by cleaning the knee properly and using sterile gloves. And of course, one of the main questions is how long does the gel injection last? So let me read it off the pamphlet that came with the gel. Okay, so duration of effect. Generally, the duration of effect for those patients who respond to treatment has been reported up to 26 weeks, although shorter and longer periods have also been observed. However, prospective clinical data in knee arthritis patients have shown benefit of treatment up to 52 weeks. That's 1 year following a single course of the 3 gel injections. Okay, so there you have it. So the range I can give you according to the data that comes with the gel, it is 6 months to 1 year. Okay, some of course will not get the full 6 months depending on the severity of their situation, also the lifestyle changes, if they chose to lose weight, adjust their footwear, if they decided to continue exercising. Okay, and then there are those who benefit for the full year and even beyond. Again, this is highly likely due to changes that they have chosen to make after receiving the gel. So I hope this video shed a bit more light on these types of injections. And keep in mind, we also offer steroid and plasma, and not just the gel. We also offer physiotherapy for those who have received the shot, and even those who don't want the shot and have not done any therapy. They can get the therapy service here done at the clinic. So you can contact us at 747-5297-308-3370. We are at number 4 Chincuna Gardens in Chincuna Road in Cunupia. That is just 1 minute away from the Cunupia police station. When you turn off by the traffic light by the Cunupia police station and you're driving as if you're heading towards Madras or Las Lomas, drive for about a minute, look out on your right hand side, you will see a purple and white sign saying Progressive Health Services by a white upstairs and downstairs building. Okay, you can also send us your x-rays, your blood tests via WhatsApp. We can take a look at it and then we can advise you from there.